So LifeTrack Medical basically allows people to read radiology cases from anywhere in the world to anywhere in the world. So it actually started, my last company was one of the first teleradiology companies in the US, and one of the things we did is we sort of kept moving westward to take advantage of the time zone differences, eventually ended up in the Philippines. And when I sold that company, I just realized that what we had done in the US with leveraging radiologists so that they could provide care for patients. So currently our clients are mostly in the US and in India. And we basically, this is mostly through network sales because we're about to release our version 2.0, our enterprise version that's really meant for hospitals and whatnot. So the other thing is we're really waiting to go live because we have a patent now that was just announced. December 29th is when we got a US patent. And so we didn't really want to put our software out until we had received that. So, but now we have clinics in the Philippines, but we also have radiologists in India, the United States, using our software. So, yeah, we're looking ahead to a pretty big future. We engineered our software to take advantage of Amazon, for instance, that allows us to leverage the other parts of the technology to reach places that were unreachable before. So now we actually have a radiologist in Cebu reading cases that originate from Metro Manila, and we've even had a Filipino radiologist in Canada reading cases at night in the Philippines. So it changes the dynamic. It allows radiologists to provide coverage even for the most far-flung reaches in the Philippines, and also in the other Southeast Asian countries. And again, we're leveraging the ability to use Amazon data services to allow us to, do things like have a demo in Cambodia. Using using the local hospital's internet. And it goes so well, they want to get the software. So it's like those sorts of things that were unthinkable in the past. And since I came from, the earliest times of teleradiology, I know what the issues are in the emerging markets in terms of bandwidth and tech and whatnot. And so we engineered it to take advantage of, the security of Amazon, the speed. They're sitting on the backbone, so we actually leverage that as much as possible. So yeah, we reach farther into the provinces. We do it at a much lower cost, so we can actually hit the B and C and D markets nicely. So data compliance is a critical issue, and we work with all the local, like our local IT partners at the and local corporate compliance officers at each of our clients to make sure that we're following the local and government and federal laws in any jurisdiction. And of course, that's one of the chief reasons we use Amazon, because it's like Fort Knox of data security. So we leverage everything we can that Amazon does, and we know how we're reading cases that originate from the U.S. and all these other countries, so we're have to meet the most stringent criteria. So. But Amazon makes it much easier, and of course working with the local compliance officers and IT people. So the emerging markets are a huge market. We work with Duke University in Singapore, Duke NUS, and they did some market research, and some numbers just sort of jumped off the page when they showed them to me. If you look at Australia in the context of the region, and they have 25 million people and they've got 1,500 radiologists. If you look at Indonesia, they've got 250 million people and 600 radiologists. So it's a 30-fold difference. So the only way to, and they've just passed a universal healthcare mandate. So how do you actually go from 600 to 6 or 15,000, right? It's a really difficult problem. So that's why part of one of the things that we got our patent for was actually a radiologist guidance system that basically helps radiologists you know, be super comprehensive in their reports and high quality at the same time as being efficient enough to meet demand. So one of the things we're working on is to work with local distributors in all these different regions, because the number of hospitals is growing. Here in the Philippines, you've got clinic chains that are growing exponentially. So to meet that demand, you have to have the ability to leverage this software that actually works in the emerging markets. And using Amazon and our software, we're actually able to execute on that vision and really reach, you know, all the different clients, you know, clinics, district hospitals, provincial hospitals, you know, private hospitals, you know, and reach it at a cost that is not only affordable, it's far less than the cost of film.